everyone, and welcome to Teach About Speech. My name is Mia Terry, and today I am joined with Erin Walsh. Hi, Erin.
Hi, thanks for having me.
Yes, absolutely. So, do you want to go ahead and introduce yourself?
Sure. My name is Erin Walsh. I have been a speech pathologist for a long time, since about 2004. I got into the field because my background is in music, in vocal music. So I have a singing background. And then I've, for the most part, always worked in the area of laryngology. So doing voice swallowing and airway disorders. I have kind of a specialty with professional voice and singers. And then I also work with little newborns who aren't feeding well. I love babies. So it brought me to additional training as a lactation consultant as well.
Wow, that is wonderful. And I know singing specialists are a little tricky to find. Would you be willing to talk a bit more about what a singing specialist is and what that kind of field of SLP looks like?
So it's very helpful to have a background as a singer. I think there's quite a few singers that are interested in this field. I have 4 patients in the past that have become speech pathologists who are singers. But essentially it is working with a population of individuals who use their voice for their profession. So they're vocational singers. And it's not always singing that's causing the problem, but it's helpful to understand the nuances of how they sing. And someone that has a lot of training as a singer, it is probably not related to their singing technique, but more how they're using their speaking voice. Do they have other medical problems? And I have kind of an unusual looking office because I have a piano, a guitar, and a baby scale.
Oh,
Just because of the specialties. But so I'll spend a lot of my time warming someone up at the piano and sort of hearing where their voice is changing and asking them to reproduce what the problem is.
what a wonderful way to blend musicality and kind of the medical field all into one profession. That's really interesting and probably a very fun work environment, I can imagine.
It's fun and loud. Yeah.
Yeah. I also wanted to learn a bit more about transnasal or transoral endoscopy and how that can be used to assist you in your assessment.
So I work in a multidisciplinary clinic. So there are 2 laryngologists, and those are ENTs that specialize in, laryngology. And then there's 5 speech pathologists in our clinic. And you don't get out the door without an endoscopy because we have to understand what's going on. Some people come into our multidisciplinary clinic where basically they see us at the same time. When we scope them together and sort of talk about, is this a medical issue? Is this more behavioral? Do you need both? Because not all of the issues are related to structural problems. So we really need to understand the instrument, or with swallowing, we need to see the function. Is this someone that's aspirating, or maybe they're having like a hypersensitivity and that's why they're coughing, not because they're aspirating. But everyone that comes in our office gets an instrumental exam.
Wow, that's a great way to work with other people too, to really get to the root of the problem. So it's good to have multiple minds and trying different strategies to find out what's going on with the instrument of your voice. That's wonderful. And then I wanted to learn a bit more about being a lactation consultant and working with babies that are having trouble swallowing or latching. Do you mind speaking a bit more about how that affects your job as an SLP?
Sure. So, just as a speech pathologist, you can work with infant feeding disorders. And my favorite age is newborn, usually healthy term newborn. Because it's difficult. If you've ever had a baby, it's very difficult to figure things out for the first month. And that's when I like to be involved. And people are breastfeeding, so I needed to understand more about that. So it's very humbling because I realized I knew nothing. But essentially what their visits look like with me is I'll assess the baby and their oral motor function. And then I sort of talked to the mom about milk production and are they doing direct feedings That means latching. Is it indirect? So the mom is pumping the milk and giving it to the baby. And so you can have a baby that sucks normally, and you can have a mom that produces milk fine, and even a baby that latches okay. But it's these like really interesting interactions with the two of them that can make feeding them an enjoyable and effective process. So that's what I do. I really like working with the families during that stage.
Oh, how wonderful. That just sounds like a lovely thing to incorporate into your practice, and very rewarding, I could imagine, to see the joy on the parents' faces when their baby finally is able to breastfeed normally. So that's just lovely. And then I guess, do you have any advice for future SLPs or students interested in pursuing a specialty similar to yours?
So for voice, what I would say is, even if you are not a singer, it is extremely helpful to get immersed in the performing atmosphere. So humble yourself and take some singing lessons, take acting lessons, because the way that you would help someone that uses their voice on air or as an attorney, or, it just it's a little bit different. You need to have incorporated into your advice how to promote vocal stamina, how to project. So it's sort of a different skill set. So I would get involved in singing. If possible, you don't have to be a good singer, but you just have to kind of understand how it works. Is different than when you speak. And for if infants is of interest, I would see if you could observe like in a NICU, observe at WIC, just seeing what normal looks like, I think is really helpful to be around babies.
Wonderful. Thank you. And then I think my last question would be, if you were to tell the world or the general population one thing about the field of SLP or swallowing disorders or anything related to neonatal infants, what would it be?
What's interesting about our degree, our specialty, is that it can be really whittled down into a focal area of expertise, which is why I like it. I would be utterly ineffective as a language therapist, autism with lots of other things. And so if you don't want to be a generalist, there are many opportunities that you can seek out to specialize your training and, even cross-pollinate in other disciplines. Like another thing that I do in the office is heart rate variability biofeedback. That's more like in the mental health profession. And so just meeting with other disciplines and finding ways of enhancing your skills so you can be really, really good at one thing if you want to be.
Oh, that's great advice. I actually love biofeedback and didn't know that it could kind of be incorporated into SLP practice, or even, something else you could specialize in alongside it. So that's actually exciting for me. So that's good to know. And then would you like to shout out your business or your Instagram or any place that people can find you if they're interested in learning more?
I'm old and not good at social media, so I don't really have any of them. I work at the University of California, San Diego, in the otolaryngology department. That's the Voice and Swallowing Center. So that's my place of employment. And then Indo Education is, I think, how you found me. And so I've had a business for quite a while with a couple partners, and we teach speech pathologists how to do transnasal and transoral endoscopy to assess voice and swallowing.
Wonderful. Well, thank you so much for your time. I appreciate it. And it was wonderful to talk to you.
It was nice to talk to you too.